Hello, this is Professor Mark Whiteley giving a podcast about venous disease and venous leg ulcers for the Lindsay Leg Club. In this podcast, I'm going to address the simple question of how do veins cause venous leg ulcers? After all, venous leg ulcers are called venous leg ulcers for a reason, and that's because the leg ulcers or open sores in the lower legs are caused by veins. But how do veins actually cause venous leg ulcers? To understand this, we have to really understand the function of veins in the body. The circulation starts with the left heart. In the left heart, which is the strongest part of the heart, oxygenated blood full of nutrients is pumped through the arterial system at high pressure, taking oxygen and nutrition to all areas of the body. This is what most people call the circulation. Of course, once this blood has gone through the capillaries and given up the nutrients and oxygen, there are waste products that have to be carried back to the heart to be excreted from the body via the liver, via the lungs, and via the kidneys. The veins have this function. Veins are very low pressure blood vessels that take blood back from all the peripheral areas, from the toes, from the fingers, from the head, back to the heart, so that all of the waste products can be removed from the blood. Once that has occurred, then blood is passed back through the lungs, back to the left heart, and the circulation starts all over again. And so the venous side of the circulation is absolutely essential, and as essential as the arterial side of the circulation, but because it's low pressure and it's not quite so dramatic when it goes wrong, many doctors and nurses tend to ignore it. For this reason, you'll often hear people being quite disparaging about varicose veins and venous surgery, although once people do get deep vein thrombosis, thrombophlebitis, leg ulcers or other venous complications, of course, then it becomes serious again. And if we understood the continuum from the early stages of venous disease and varicose veins or hidden varicose veins all the way through to the severe end results of the venous problems, then we could prevent them and we could look out for them and we could understand them better. So how do veins cause venous leg ulcers? As I've already said, veins are full of deoxygenated blood, which is full of the products of metabolism, or as is commonly called, toxins. We have to get these toxins and deoxygenated blood, which is quite acidic, away from the tissues. As far as venous leg ulcers is concerned, we're really only going to talk about the venous blood in the legs. When you are lying flat, there's just enough pressure left in the venous blood from the heart that's pushed it all the way through the capillaries to get it back to the heart. Unfortunately, as soon as you sit up or you stand up, there isn't enough blood pressure left in the venous blood to get it past the ankles, and so there's an accumulation of this waste product around the ankles. Not surprisingly, this is also the site of most venous leg ulcers and most venous disease. The damage of the skin that leads to the venous leg ulcers is caused by a process called inflammation. Many people erroneously think that inflammation is caused by infection because inflammation causes heat, it causes pain, swelling and redness. However, it is actually the body's response to an insult and is how the body tries to heal. So how does venous disease cause inflammation around the ankles? The first and probably the easiest to understand is that caused by varicose veins. Now, unfortunately, the term varicose veins is quite misleading because when you think of varicose veins, you're thinking of bulging veins on the legs. However, what doctors should be thinking about is what is causing those bulging varicose veins. And the answer is venous reflux. This is caused when blood does not flow a one-way system back towards the heart, but it starts falling back down the veins or squirting out of the veins at high pressure, causing damage to the skin around the ankles. Now, when you're sitting or standing, there's a gravitational force keeping the blood around the ankles, and to get it back to the heart, you have to actually have some movement. And any movement around the ankles, such as walking or wiggling your feet, will cause blood to be squirted up the veins. Of course, squirting the blood up the veins towards the heart is only half the answer, because once you relax, the last thing you want is blood to fall back down the same veins again, because that would be called venous reflux. So what happens in normal people is every 8 centimeters or so up the veins, there's a little pair of leaflets called valves that open and shut as the blood goes past. When blood is squirted up the veins, the valves get pushed into the vein wall and blood progresses back to the heart. However, when movement stops and blood starts falling back down the veins again, the valves get caught and the valves close, occluding the vein lumen and stopping the blood falling back down towards the feet. In this way, blood is continually pumped up towards the heart and is not allowed to fall back downwards, so there's only forward flow. Unfortunately, some people have the predisposition that these valves will fail. It tends to run in families, although it can happen to anybody. When these valves fail, it means that in certain veins, the ones in which the valves have failed, blood can flow the wrong way, in other words, the wrong way in the one-way system. This is called venous reflux. Sometimes these refluxing veins can come near the surface and bulge, and then they're seen as varicose veins. However, in just as many people, the reflux stays deeper inside the leg and refluxing blood goes back down to the ankle with no sign in the initial stages near the surface. Medically, this is often called superficial venous incompetence or superficial venous reflux or even chronic venous incompetence. However, in 2011, I published a book called Understanding Venous Reflux, and in that book, I renamed this process hidden varicose veins. And now this term is starting to be used very widely because it really is exactly as it says. It's the same problem that you have with varicose veins, except the bulging veins on the surface. Now, when this venous reflux occurs, what happens is the blood accumulates in the veins around the ankle, often deep inside so you can't see them. And that venous blood, which we've already said doesn't have any oxygen in it, it's actually got carbon dioxide and the toxins associated with the products of metabolism, all accumulate around the ankle and can't get pumped out easily because every time they're pumped out, they keep falling back down. As such, this accumulation of this blood, which is very acidic and full of these noxious chemicals, starts causing inflammation in the ankle veins. If this is not corrected, this inflammation starts causing damage to the overlying skin. First of all, just being noticed as some aching or heaviness in the legs. Then if the veins aren't fixed, it goes on to cause swelling, localized around the ankles. Then if they're still not fixed, it goes on to skin damage, which can be red venous eczema, brown hemosiderin, or even a hardness of the area called lipodermatosclerosis. If all of these signs are still ignored and the veins are not treated, then this goes on to skin breakdown and venous leg ulceration. The second way that venous leg ulcers can be caused by veins is a process called venous stasis. And in some ways this can be thought of as being similar to venous reflux, in that it results in veins around the ankles being full of this old venous blood, which is acidic and full of toxins, and that blood not being pumped back to the heart so it can be reoxygenated and all the waste products got rid of. However, in pure venous stasis, the reason that the blood accumulates in the veins around the ankles is that it just isn't being moved on. So rather than accumulating there because every time it tries to get out is falling back by reflux, in this situation, the patient isn't moving enough. This is obviously due to immobility of some sort, which might be due to temporary immobility such as postoperatively, or it might be due to paralysis, it might be due to disability, it might be just due to the fact that the ankle joint doesn't work. Whatever the reason, blood isn't pumped out of the ankle and therefore it accumulates in these veins, often hidden away underneath the skin and not visible. But what does become visible is the swelling, skin damage and eventual venous ulceration, as we discussed with varicose veins. Finally, the third sort of venous disease that causes venous leg ulcers is venous obstruction. Venous obstruction occurs in the deep veins in the legs or the pelvis. It is caused when there's an obstruction to the flow of blood out of the leg when it's being pumped, due to either compression on the veins or something inside the veins, which is often a deep vein thrombosis or scar tissue from a previous deep vein thrombosis. In the past, it was often thought that patients with this sort of condition actually had reflux in their deep veins, and some do indeed have that problem. However, increasing research is showing that when people have had previous deep vein thromboses, it is quite often the obstruction of the scar tissue that causes the problems rather than any venous reflux caused by the valves not working in the deep veins. However, both reflux and obstruction can coexist. The reason obstruction causes venous leg ulceration is often thought to be due to high pressure in the veins around the ankles, but actually it's much more likely to be due to venous stasis because the blood can't be pumped out of the calf. Of course, the obstruction does cause a higher pressure, but pressure in itself in the veins doesn't really cause much inflammation if it's part of the attempt to pump blood out. So therefore it's more a marker that there is obstruction than actually the cause of the inflammation. So as you can see, all three different sorts of venous disease, reflux, stasis, and obstruction, all cause inflammation around the ankle, which damages the skin, causing symptoms, heaviness and aching, followed by swelling, followed by red marks, brown marks, hardening of the skin, and eventually leg ulcers, if the problem isn't reversed. It is for this reason that we now know that venous leg ulcers can be improved considerably and occasionally even cured in the medium to long term by treatment of the underlying cause if it is found. Hence the NICE, the National Institute of Health and Care Excellence guidelines from July 2013 say that anyone who has got a venous leg ulcer, even if it's healed, must undergo venous duplex ultrasound scanning to find out whether they have got reflux. And if that reflux is present, then it should be treated. The guidelines don't really go on to talk about stasis and obstruction, as venous disease is still evolving, and those guidelines always follow on from randomized controlled studies, and therefore, by necessity, are usually somewhere between 10 and 15 years behind what we know in the research world and what we can offer at specialist clinics to our patients. I will now bring this podcast to a close, and in conclusion say that we've discussed how venous disease causes venous leg ulceration, and it's usually by one of three mechanisms: venous reflux, venous obstruction, and venous stasis, although all three have the final common pathway of inflammation around the ankle. It is also logical that finding the causes and reversing them is essential if we're going to start getting on top of venous leg ulceration, improve the rate of healing, and reduce the risk of recurrence. This does not detract from dressing and compressing venous leg ulcers, but actually, if used in conjunction with this, would give our patients a far quicker return to normality and a far longer ulcer-free existence once the venous leg ulcer had healed. In future podcasts, I will discuss the different sorts of venous reflux and different veins that are involved, the different ways we investigate them, and the different treatments that are now becoming available.